2 years ago today, Louisiana reported its first death from COVID-19. It was a turning point in the pandemic, and tonight there is another one. The state's 2-year-long public health emergency will end on Wednesday. Mike McDaniel explains what it means and why you may not see much of an immediate change on the surface.
With applause from state lawmakers Monday.
On March 11, 2020, I signed a public health emergency for COVID-19.
The announcement from Governor John Bel Edwards many Louisianians have been waiting for.
And after 24 months, I will not be renewing it.
Simply put, as of Wednesday, there will no longer be an official health emergency in the state. It's a decision, the governor says, with direction.
I have met with the Division of Administration, GOSEP, the Department of Health, and the Louisiana National Guard to ensure that there will be no federal aid repercussions or other adverse consequences from not reviewing the proclamation.
Things like masking, testing, and isolating are still recommendations and still part of policies at school districts like NOLA Public Schools and Jefferson Parish Schools. Local governments can still create their own rules, like in New Orleans, where the vaccine mandate stays in place for now. A city spokesman released a statement saying there will be no changes to our local guidelines at this time. The New Orleans Health Department is continuing to review data from the Mardi Gras period, and we anticipate an announcement regarding vaccination requirements on or before March 21st.
Since hospitalizations are such a critical part of evaluation and they generally lag infections by 2 to 3 weeks, it's key to have this period to see just what effect Carnival truly had.
Governor Edwards calls the return of parades a breeze of hope, but says just because the health emergency is ending doesn't mean COVID is.
I don't know what the future holds, but I do know that we are in a much better place today than we were 2 years ago.
A place filled with a sense of relief after so much uncertainty. Mike McDaniel, Eyewitness News.
The state health department is reporting more new cases today than we saw much of last week. But remember that these numbers include Friday, Saturday, and Sunday. The state is reporting 537 new cases. When you average that number out, it comes out to about 179 cases each day. The number of hospitalizations and people on ventilators continue to drop.